Hello and welcome back to Clinical Psychology Community UK. My name's Holly and I'm a trainee clinical psychologist in the UK and I'm currently in my third year. Thank you for joining us today. We are going to be reviewing The Gift of Therapy by Irvin Yalom. You probably will know this book because it is recommended to basically everybody wanting to be in psychology. I know most people get this as a going away present as well when you leave a job. This was recommended to me when I was an assistant psychologist. Just before I started training. So that's when I bought it and first read it. So let's get into it. So what is the book? The full title is The Gift of Therapy, an open letter to a new generation of therapists and their patients. And I have the revised and updated edition, this edition here. There are quite a few editions out there, I think, that have maybe some extra little bits in. So there are 85 chapters. It's not that big a book. So the chapters can be quite short, like even just a couple of pages or a page. And each chapter provides a little nugget of advice for therapists based on Yalom's experiences as a psychotherapist. Some chapters reference the people that he's worked with or composite clients, and some just have kind of reflections on the work, some have just advice. But you can buy it online and I will put some links down in the description as well. So firstly for me, the therapy talked about in the book feels very different to the therapy that we're taught on the declin. And I think there are so many reasons for this. I think, firstly, Yalom's psychotherapy feels a lot freer, a lot less restricted, or perhaps a lot less manualised than therapy that we're being taught to offer on the declin. I think the big difference is that we're talking about training and a very experienced psychotherapist. So if I wrote a book about therapy with my biggest lessons in now, based on 2 and a bit years of doing therapy, and 20 years time, they'd be very, very different. So there's differences there. There's also, I'm being trained in the UK. This is practice in the US, there are going to be differences there. Although I do think practice as a qualified therapist in the UK is probably quite similar. Maybe just not in the private, non-private worlds. But in the UK, we generally offer, in the NHS anyway, we will offer a time-limited therapy. And that, it could be 6 weeks, it could be 12 weeks, it could be a year, but usually we have to have like an end to it. Yalom calls this a validated approach, but he is very quick to say that non-validated therapies are not invalid, which is true. That is absolutely true. But it just means that they're not evidence-based. And while we're training, we're taught the evidence-based approaches. And I remember reading the book before training and being really excited about being a therapist and getting to try some of these things. But there are some things that feel very different. Not necessarily in a bad thing, in a bad way, not necessarily that one's worse than the other. It's just they're very different. And it's important to reflect on some of those differences, I think. Secondly, some core principles of psychotherapy are constant across approaches. So as I said, I'm being trained in a very CBT way. We might be doing some CFT, some ACT, some other different kind of systemic, other types of approaches, and being integrative with those, the more confident we get. But the principles are all the same, actually, with Yalom doing a completely different type, very, very different. Feels a little bit more psychodynamic-y, like a little bit longer term therapy. But the key principles are there. So things like empathy and curiosity and compassion and validation and normalizing, all of those things are really important skills to have down for therapy broadly. Not just any particular type of therapy. So I think that's really nice that comes across. Number 3 then, therapy is not perfect. Yalom reminds us that therapy is not linear and it can't always be manualized. You can't manualize, here's how to build a therapeutic relationship with somebody. There are things that you can do, but it really depends on the person and who you are as well. Initially, it made me feel quite conflicted, because what I knew of therapy was what I was being taught, which is these kind of more manualized approaches, more kind of prescribed, and how effective they were. And Yalom talks about therapy and being a therapist from a position of a really experienced therapist, but not an expert. I think there's something really nice about the humility in his writing that makes it really accessible. because I remember reading, first thinking about what I wanted to be as a therapist. And I was like, okay, I've got to make sure that I don't harm anybody. I've got to make sure that I don't challenge people too much. I've got, I had rules for myself on how I thought I should be as a therapist. And I think it's really helpful to remember that if the therapy doesn't work, it's not just down to you as a therapist. There are two people in that room, and also it's not just because you're a trainee that things might not be going right. There are loads of other reasons, and nobody's really at fault, nobody's to blame. It just sometimes is that clients can't engage in that. They might have loads of other stuff going on that they can't engage right now with the therapy. So I think it's just a really helpful lesson that therapy is now perfect. Number 4 then is I plan to read this throughout my career, actually. So when I first got it, as I say, I was pre-training, and I remember thinking, I cannot wait to consume all of this knowledge and get it into my brain. I can't wait to just learn all the lessons in these pages and bring it to therapy. I can't wait to try it all. And that's great. The enthusiasm is great, but it's just not always possible. It isn't to say that we need to be critical of things, but just being able to kind of critique things and be curious about information is important within any field in psychology. And I think having space for that, as well as not just going, oh, these are all the lessons from a really experienced practitioner, I need to learn them all. Actually, no, sometimes it's critiquing them and thinking how it will work with you. And the next time I read it, I was about halfway through the course, so not far off this time last year, actually, was the last time I fully started reading it. In preparation for this video, it just took ages to get there. And even though I'd only had sort of 18 months, 2 years of therapy experience, I was reading it in a different way, and I anticipate reading it in a different way in the future. It's kind of like if you watch film. The first time you watch it, you'll enjoy it. You'll take some bits from it. And the second time you watch it, you might notice something you hadn't before. I think it's the same premise. So I think if I read this in 10 years' time, I'll be a different clinician and a different therapist reading it. So I think the book can grow with you, if that makes sense, because the book stays constant, but we grow and we take different pieces into it, and the lessons that we learn the first time we read it may be very different to what we learn the third or fourth time. So I do think it's worth, I really do try not to promote lots of stuff to you to buy. I do think this is one that you can ask for as a gift or try and buy, because I do think it is a really useful thing. And every time I read it, I do get something else out of it. Fifthly and finally, I think this is a useful book. Not just as a therapist, but as someone that goes through therapy. I think it's a really useful introduction to what therapy could be. And actually, if you could recommend it to a friend, or lend it to some friends or colleagues or partners, and say, look, if we've talked about therapy before, maybe you'd be interested. Just have a little read and see what you think of this, because you can read it even if you're not a therapist. I think it's a really accessible read, and I think it can help. As I say, I would probably rate this a 5 out of 5. I have to say, I think there are lots of bits in it that I don't necessarily agree with, but that's not a bad thing. I think it's really important to have stuff that challenges you, where you will think differently about it. I just think there's a lot of stuff in here that's really useful as a therapist. So do have a read of it, and let me know if there's any other books you want me to review in this series, or if you have any thoughts about this book, drop me a comment down below and I will try my best to reply. Thank you so much for watching. It really means a lot, and take care.